What happens when a patient gets all-on-4 surgery from a highly credentialed surgeon, but the results just aren't right? Our patient trusted a renowned surgeon at his own implant center. On paper, everything looked perfect. Yet, as the treatment progressed, she sensed something was off, both in feel and appearance. She never mentioned her smile makeover to anyone until she ran into a close friend whose smile looked noticeably better. Turns out, they had both had all-on-4 done. Her friend at our practice, and she at the other office. That moment of comparison brought her to us, hoping for the confident smile she deserved. Reviewing her records, one detail stood out immediately. The two lower front implants set extremely facially, meaning too close to the jaw's outer edge. Here's what made this baffling. She had a wide ridge, meaning ample bone. In all-on-4 surgery, the bone is fully exposed. So that made me question, was a CBCT scan not thoroughly reviewed? Did they fail to uncover the bone completely? Or are some surgeons still defaulting to the largest implants, regardless of anatomy? We don't have the answer, but we do know these implants were poorly positioned. In fact, you can see the implants are as exposed where bone should have been. We refer her back for soft tissue grafting. One side responded, the other remains compromised. Functionally, she also felt her prosthesis was too bulky. That bulk often comes from suboptimal abutment selection. Ideally, angle abutments are chosen during surgery to minimize bulk and create natural contours. While many all-on-4 surgeons appreciate this, prosthodontists specialize in prosthetic design and excel at balancing form and function. In her case, her original prostheses were crafted by a lab tech. Talented, yes, but without the clinical insight of a prosthodontist. This disconnect often leads to less than ideal results. Dr. Saeed is now swapping to abutments with different angles to thin the prosthesis. But here's the catch. It's been more than 6 months since her surgery. The implants are effectively set in stone. If they're misaligned, the only correction is removal and repositioning, something she doesn't want to go through. We're now doing our best to work around the less than ideal foundation. So here are the final takeaways. Takeaway number 1, ask, who is responsible for the prosthetics? Many surgeons delegate to lab techs, often to cut costs by skipping a prosthodontist. That can backfire. If you're serious about all-on-4, make sure your team includes at least one prosthodontist for top-tier aesthetics and function. Takeaway number 2, credentials do not equal all-on-4 mastery. A surgeon with all the credentials in the world, but who only does 1 or 2 all-on-4 surgeries a year, is far less experienced than one who handles them routinely. Takeaway number 3, when you go to your consultations, ask the hard questions. Request scans of completed cases, not just polished before and after photos.